Good morning, everybody. I'm going to talk about numerous sclerosis complex. I am Juliana Alvarado. Definition is a genetic disorder characterized by the growth of numerous non-cancerous begins tumors in many parts of the body. These tumors can occur in the skin, brain, kidney, and other organs, in some cases leading to significant health problems. Application in nursing. To this illness, we have some drugs that are Medicaid that are prescribed to doctors. They are vigabatrin, corticotropin, prednisone, valproate, topiramate, lamotrigine, oxcarbazepine, and many times. This is the typical daily starting dose, the maximum dose, and comments about this group of medicaments. In this dose, we have the vigabatrin, that is the first line therapy in infantile sons. And the second one is corticotropin, second line therapy. And prednisolone is a potential advanced effect, includes hypertension, osteoporosis, gastric ulceration, and immunosuppression, etc. In the other circle, we have a video about the tumors, brain tumors, and developed organs in children.
Tuberous sclerosis is a disease that manifests across the age spectrum. Children predominantly have neurological manifestations, including seizures, developmental delay, and there's a strong correlation with autism spectrum disorder as well. Dermatologic or skin manifestations that come out that, depending on the patient, can be more or less burdensome. So to fully get the appropriate treatment for tuberous sclerosis, having a multidisciplinary treatment team is a key aspect of the disease and its treatment. The fact that we have a dedicated space for the treatment of children and adults at the same time. So that's really important because tuberous sclerosis is a genetic condition, meaning multiple family members, with children and adults, can have the disease. So instead of having have families go to two separate places to see providers, we have a dedicated space for both pediatric and adult neurologists, as well as other experts in tuberous sclerosis that can see patients and families together.
Very good. Have an ISO applied in Ecuador. Cuenca, a city in the Andean region of southern Ecuador, has 5,091,996 inhabitants. A decade-old study showed the prevalence of multiple sclerosis in Cuenca was 75 cases per 100 inhabitants, but no new epidemiological studies in this city has been performed since then. That photo shows the neurological cells in the brain of a patient with epilepsy attacks. And we have another video. This explains us how to have a care in the teeth of this patient, and what is a brush that has used it.
First things, keep working at it. Try and make it part of a daily functional routine. It's a hard adjustment for children of all ages, especially those with special healthcare needs. And the more of a routine it becomes, the easier it is. Start young. You, particularly with kids, right after they come out of the bath or shower, and they're all wrapped up in their towel, lay them down. You already have their hands down. They may cry. It honestly makes it easier for you to see and do what you're doing, and it gets them used to the process. So start young if you can. If they're older, don't give up. Keep trying, keep working at it. Use a mouth prop. There are devices that you can get from your dentist, or you can buy online that can actually help you hold the child's mouth open while you brush. And there's plenty of tools that are available for parents who are trying to brush a child's teeth who may not be as compliant as one would hope for whatever reason. Obviously, there's traditional toothbrushes, but if that's not working for you, there's what we call surround toothbrushes. Surround toothbrushes are toothbrushes that actually brush on all three sides at once. So you can get these from your dentist, but they actually go right over the tooth, and they get all areas of the tooth at one time. So with one pass, you kind of get all areas of the mouth. There's also mouth props. So we talked a second ago about mouth props you can put in their mouth, but there's also foam mouth props that you can get that you put in sideways and you rotate, and those can help hold mouths open. And fluoride. Fluoride is our bread and butter of dentistry in general. It fights cavities. It helps reharden, soften tooth structure, and it is important. If we can't get it on with a toothbrush, then a wet washcloth is not an equivalent opportunity, but it is better than nothing. So a wet washcloth to wash off some of the bacteria on the mouth and apply the fluoride is a great technique. If we can't use fluoride, baking soda. The pH of baking soda will raise the pH in the mouth, and that'll help fight cavities as well. So there are plenty of tools that we can use that if brushing doesn't work, we want to be trying our best to prevent cavities at home.
This is pros and cons. We have the pros about the treatment of tuberous sclerosis complex. They do not always have a bad prognosis. Patients respond very well to treatment. Cons: angioplasty, renal cysts, chronic kidney disease and arterial hypertension, speech problems, difficult coordinating movements. You have other video this explain us how do surgeons do the surgery in the brain in kids.
So this tells us very quickly that we're going to figure out if a child is going to respond to further medication or not. Every day there's more and more medication. It's very important to, especially when we're dealing with a child, is not to lose time in terms of escalating treatment. Because a child can spend years and years trying each new medication that comes out. And we know very quickly that if the first two medications haven't worked, the chance of further medications working is split. So we need to think about other treatment approaches. So why do we even consider epilepsy surgery? To some, that may sound very radical. Why do we need to do a brain operation to stop seizures? The answer is quite simple. Some of the disorders that are very, very difficult to treat the epilepsy with medications, such as tuberous sclerosis, can sometimes be the easiest to treat with surgery. And we know that. So epilepsy surgery it's not a new thing. It's been around for many, many years, many, many decades. And there's many, many benefits to stopping seizures. First, The first goal of epilepsy surgery is to either stop or lessen seizures as much as we can. We want to prevent the harmful consequences of seizures, including early death. As you can imagine, if you have a seizure that can lead to accidents, falls, you can break your bone, injure yourself, you drown in a swimming pool. So there's a lot of concerns for a child who has seizures. There's also this entity called sudden death related to epilepsy, food epilepsy. It's got a 1% chance per year, which may seem low, but if you take a young child and you multiply that over the course of their lifetime, that can be significant risk. So as much as we can, we'd like to lower that risk or eliminate it altogether by treating the seizures as possible. We want to prevent the cognitive, behavioral, and psychosocial problems related to epilepsy. Epilepsy there's still a lot of stigmatization for children who have seizures. It can result in bullying, it can result in marginalized in society. So as much as we can, as surgeons and neurologists, we'd like to stop the seizures if we can, if not, lower them as much as possible. We also want to avoid the side effects of medication in a growing child's brain. We don't know what side effects these medications have. And for a developing child, we think it's very important that we can limit the amount of medical therapy, or at least not add on more and more. That could potentially be very beneficial. So how do we find the epileptogenic tumor? This is one of the discussion topics that comes up quite frequently when we discuss children with tuberous sclerosis, especially as you can imagine tumors all over the brain. Which one or two, sometimes three tubers may be causing the seizures. So to do that, we have a number of tools available at our disposal. First involves seeing a neurologist so they characterize the seizure. And sometimes nowadays, videos are very helpful. If you can show your neurologist, based on the appearance of the seizure, they can tell you where the seizure, or at least they can have a guess as to where the seizures may be coming from. Now, with tuberous sclerosis, like I said earlier, they're coming from. And for this very reason, treating children with tuberous sclerosis complex for their epilepsy is actually extremely challenging. So for this reason, you need to be considering epilepsy surgery for your child. You need to get, don't have enough data. We may have to do something called an invasive EEG. So what that involves is we do a surgery where we implant a grid of electrodes on top of the brain. And here, once we implant this, the child comes back to the ICU where we hook them up to the monitor and we try to record as many seizures as we can. And that usually tells us where exactly the seizures are coming from with much more precision than before. Not only we can tell that, but we can also do something called brain mapping, where we can figure out where exactly the motor area of the brain is, the sensory area, the language area, and make sure that any area that we need to remove does not involve those important areas of the brain. Now, this can
Conclusion. Tuberous sclerosis complex is an strange illness, but the doctors can diagnose by many ways and exams. It is important to every patient know the illness and they will have a good lifestyle after drugs and surgery in some cases. Thank you.